I'm Evelise Pereira Barbosa. I'm a predoctoral researcher in IS Global and UPF. And I'm supervised by Mark Newhausen, and I work with health impact assessment and urban and transport planning. The aim of our study is to understand how urban and transport planning practices affect our health. We include 1,000 cities, and you analyze different environmental exposures and how each one of them can influence the impact on mortality and morbidity. So the environmental exposures that we use to analyze is air pollution, temperature, road traffic noise, and lack of green space. So first, for the air pollution study, we retrieve data based on monitoring stations, and then we apply different statistical models to estimate in other areas the air pollution that we have. For the green spaces, what we do is to retrieve data based on satellites that show us the amount of green that has in a specific area, and also publicly available land use and land cover maps that show us the public green areas. So once we do this analysis for each one of the grid cells, what we do is to compile it by each city. So we analyze based on city level, what is the amount of burden that each city has to not achieving international exposures for air pollution, for green spaces, and then we compare in a way to create a kind of ranking that what is those city that has highest impact on health and what is those that has lowest. We have this data already available, mostly of them related to air pollution and now the green space ones. It's available on our website that's called isglobalranking.org. I think the main importance of this study is that we want to understand how the health inequalities in the European cities are related to urban and transport planning. What I like most is this capacity of translation, that we have. Because I think the evidence is there. Everybody knows that air pollution, lack of green space is impacting our health, but we don't know exactly how to translate this knowledge into prioritization and how to construct specific policies that could promote health in the end.